Good morning. My name is Christina Dozier, and I am the Executive Director of Children's Defense Fund New York. CDF New York is the absolute best organization in the entire world, in my opinion. One thing that's what I often say to people, and I actually really mean it. And so while I have the utmost love and respect for this organization, at the same time, I wish that it was an organization that didn't need to exist because we are an organization that fights with, and alongside youth, parents, children, communities who are impacted by a variety of injustices. And so today we are super excited because we are releasing our New York Children's Budget, a community vision for prioritizing our children. It is what we feel is the moral document that the New York State Legislature and the governor needs to look to as they seek to create a budget that really centers and prioritizes children. If you don't know much about Children's Defense Fund, Children's CDF is an organization that was founded by Miriam Wright Edelman. It is an organization that grew out of the civil rights movement. We serve the largest, most diverse generation in America, the 74 million children and youth under the age of 18, and also the 30 million young adults under the age of 25. Specifically, the CDF New York, office, specifically the CDF New York office focuses on different issue areas. We focus on economic mobility and health equity. We also focus on child welfare and youth justice, along with educational justice. We also operate two direct service programs. One is Freedom Schools, and the second is our Beat the Odds program for young people. And so today is so important for our children and our young people. When you think about everything that our children and our families and our community have been going through as it relates to this pandemic and also the accompanying economic recession, we know that we need our state to step up in a major way to make sure that they are, funding programs so that our children can be whole and our communities can be restored and be rebuilt. And so that's what we are here to talk about today. Specifically, in this hour that you're with us, we are going to address universal childcare, ending New York lead poisoning, youth justice, youth mental health care as well. And so we're super excited to be with you. We have a diversity of voices who will be speaking authentically as it relates to those particular issue areas. And so with that being said, I will pass it off to Senator Broussard to talk about the need for universal child care in the state of New York.
Thank you, and thank you for having me, and good morning, everyone. So my name is Jabari Broussard. I am a state senator in Brooklyn, and before I was a state senator, I was a public school teacher. And in July of 2020, after winning the primary, one of the first rallies that I was doing post-winning the primary was with the Brooklyn Coalition of Early Childhood Programs, fighting for money for childcare, basically along the slogan that if there's no childcare, there's no work and there's no economic recovery. And really honoring the frustration that people were feeling at the fact that some federal money in the stimulus had not come down yet to the working people that needed it in order to keep their programs open. When I took office last year, I was appointed chair of the Children and Families Committee, which does a lot of things with juvenile justice system, with the foster care system, but also childcare. And I remember one of our first budget battles was fighting to lower co-payments for parents who were seeking childcare. The governor had proposed 20%, we wanted 10%. And it was a big fight, and it was frustrating even to have to fight because the federal recommendations were at 7%. And my thinking was that the co-payment should be 0, in the same way that parents don't pay co-payments for enrolling their kid in public school. We won the fight, but we're back for more. So this summer, I started partnering with some of the people on this call to start building out what a universal childcare system looks like. we toured all across the state, talked to providers, parents, administrators. Over 1,000 people participated in our tour this year. We built out the Universal Child Care Act, which now sits in the New York State Legislature. And really, we're just following the inevitable. Every time we invest more in childcare, the effort is to make more people eligible. And the effort is also to reduce the amount of money that people have to pay. And if you follow those trajectories, you get to a place, if you keep on following those, you eventually get to a place where everyone is eligible and none of them have to pay. You get to a system akin to our public school system, which is a universal system, free at the point of service. So that's what we're fighting for. We have the state budget coming up. It is due April 1st in New York. The One House budgets are due March 15th. We are asking for a $5 billion down payment into a universal childcare system to begin building out infrastructure, making more people eligible, and raising wages for providers. And if you haven't already, call your legislators. If you don't know who they are, look them up, tell them $5 billion, don't settle for anything less for universal childcare in this year's state budget. And I believe we have a really good shot if we all work together. So let's do it. And I will pass the mic to incredible woman who was part of the tour and was I can't speak highly enough to how integral she was to our weekly Zoom sessions and the tour itself and organizing. So that's Stevie Vargas.
Thank you, Senator Broussard. Can I get a thumbs up? Can everybody hear me? Because I have my headphones in. Awesome. So my name is Stevie Vargas. I'm the Upstate Campaign Coordinator with the Alliance for Quality of Education. But most importantly, beyond that, I am a single parent struggling to access childcare. So you might hear my kid in the background at some point. I know you can see the TV on right there because that's how I keep them occupied when I'm working. And yes, I am working. So you have a real life view into what I'm dealing with. You probably saw me giving him the side eye to keep it down or stop jumping on the couch or don't touch that marker. And this is the reality for a lot of working parents and a lot of working caregivers. At a very young age, I made the conscious decision not to have children, just because I saw what a struggle it was for my mother. Being a single parent, making minimum wage, single parent to 4 young daughters on welfare, seeing the battle she had to go through as she would go to the DSS office and fill out paperwork to try to get subsidies for childcare, and seeing the emotional stress and toll it took on her. Because anybody who has been through that system knows how difficult and how dehumanizing it is to really unveil every aspect of your life, pull out every pay stub, every receipt, to prove that you need assistance. And God forbid, if you get a promotion at work or a dollar raise, a lot of parents end up losing their subsidies because of that $1 that they make extra, or maybe they worked overtime that week and now they no longer qualify. So it really puts parents and caregivers in the situation where we can't progress in our workspaces. And then society looks at us as lazy or we're not trying hard enough. So I made a conscious decision not to have kids just because they're super expensive. And I did not want to go through that same struggle. However, when you make plans, the universe laughs at you. And I ended up adopting my biological nephew. And it's something that I would do over and over again because that's just what I do. And family is everything and community is everything. And while I had my nephew, through the foster care system, the state paid for childcare. And it was the first time anybody in our family did not have to worry about access to childcare. I could focus on my job. I could focus on being a parent. Once the adoption was finalized, I lost access to all of those subsidies. And because of the stringent use of means testing and not updating the poverty levels, they deem me as making too much to qualify for any kind of subsidies. So telling a first generation Latinx woman, a first time parent who doesn't really make enough to like purchase my own home or do anything outside of live independently is now saddled with paying $1,133 a month for childcare. That's more than most people's mortgage payments. That's more than my rent. It's pretty close to my rent, but it's more than my rent. Expecting single parents to pay that and find equitable childcare is not feasible. And like Senator Briscoe mentioned before, access to childcare is more than a women's issue. It's an economic issue. It's a community issue. And seeing how my own child's mental health has been impacted by lack of access to childcare because he doesn't have access to other children to play, to gain those social skills, to burn off all that energy because he has a lot. I know he's in the kitchen right now and I'm gonna run as soon as I get off this call. But that is what a lot of people are experiencing right now. And I can go on forever, but I won't because I want to respect the many speakers that are here. But I wanted to speak from my authentic self, what it's like as a parent, not having access to childcare, the emotional toll it's taken on me, not feeling like my best as a parent or as a worker, and trying to give 100% to both aspects is causing parents to burn out, leave the workforce, and settle for a life that they necessarily didn't want or they wanted better. And we see it all across the board with providers, and it predominantly impacts Black and Brown women. But this is all of our problems because we will pay for it in the long run if we do not get $5 billion for universal child care. And $5 billion is about 1% of our state budget. So if you got to think about it in those terms, it is not a lot. It's something that we can do and it benefits all of us. So I want to thank Senator Briscoe for doing that tour, because before you put pen to paper to create any type of legislation for directly impacted people, you need to do the work and meet with them and hear what they have so that we can create equitable legislation. And we're going to do that. So thank you so much. And I'm going to pass it to Ben Anderson.
Thank you. Thank you so much, Stevie. Really, really great to hear your voice and your perspective. Good morning, everyone. My name is Ben Anderson, and I'm the Director of Economic Mobility and Health Policy at the Children's Defense Fund New York. Now, can we get some more love for Senator Briscoe in the chat? And some love for Stevie too. Now, they both have now told you how critical it is to set New York on a path towards universal childcare. Our childcare system has been broken for way too long. And I can also speak personally to this as a father of 2 young children in Brooklyn. My youngest son will be 1 year old in just 3 weeks. And infant care is so expensive that my wife and I drive to Philadelphia to pick up our mother-in-law and take her back and forth every 2 weeks so she can watch our youngest rather than pay out of pocket for care. That's not sustainable for us. That's not sustainable for grandma. And that's not sustainable for most families. But we're now struggling to find an open childcare slot for him. And we don't know what we're gonna do after April 1st, after he turns 1. So as Senator Briscoe explained, it doesn't have to be this way. But to make things change, we need your help. So in the chat, in the YouTube feed, and under the stream for folks viewing on our website, you'll find a link to send an email to your elected officials to take action. We made it really easy for you. All you have to do is enter your name and address, and an email will automatically populate. So you can send it to your elected officials. So please take a moment and click on the link and make your voice heard. And with that, I'm now going to turn it over to a fierce young advocate named Justin Mercado to talk about child welfare. Justin.
Good morning, everyone. My name is Justin Mercado. I'm a child welfare advocate and liaison to CDF-NY. And also, sadly, I'm a former fostered youth. So I'm going to address a program called the Kinship Guardianship Program, also known as KinGAP, which would have been useful during my time of need. See, it was a way for children in foster care to be sent away with their own family members instead of sent with strangers. Now, back then when I was younger, I was snatched out of my home and sent away to live with strangers, far away from my house. Now, back then, it was a lot different, but things are different now. So why can't it be for the better? Now, as Senator Jabari just said, there's $5 billion that can be used towards these programs. can benefit all of us economically. I don't see how the kinship guardianship program can't be a part of that. Now, on paper, Kin Gap is a great idea. It's awesome. But it's making sure young people can live in their own family's homes, like an auntie, an uncle, grandparent, even a familiar friend, because nowadays people consider friends also part of family. But because of the way we fund Kin Gap, at the state level, it's not being used as we should. Counties are stuck between paying for foster care and Kin Gap, and the result is they don't make the program available to all young people who could use it and live with family. I didn't have that option. So not only are some young people being sent to strangers they have no relation to, and strangers that don't have an obligation to take care of them. They just sort of like a coin toss. Some get to go family, some don't. Now, to remedy the situation, the solution is that we can pass a state budget that makes Kin Gap independent. And it sets aside $25 million. Now, from $5 billion, that sounds like a real low number. And we can separate it apart from other foster care dollars to invest in supporting young people living permanently with kin, so that what happened to me years ago doesn't have to happen to anybody else. We need to do this now because children are the future. And what this pandemic has shown us, that future is bright. Now, because children and adolescents need to have a way out of foster care, and if we can do that by supporting extended families and people who are close to them, it's the right thing to do to ensure a promising future for fostered youths. Julia, pass it on to you.
Thank you, Justin. You are a tough act to follow. And thank you so much for uplifting the kinship guardianship program. I'm Julia Davis. I'm the Director of Youth Justice and Child Welfare at the Children's Defense Fund in New York. And I have the incredible privilege and pleasure to work with Justin. He told you about the need for us to reform the kinship guardianship program in the budget this year. And I'm so glad that Senator Brisport and Assemblymember Hevesi and many others are supportive of that, just like Justin, and I hope all of you are. This is also a moment for us to think about other ways to support family members. And while Senator Brisport is leading the charge on universal childcare and that $5 billion that we need for families across the state, he's also taken a bold step in child welfare and family support by creating the Children and Families Reinvestment Act. And that's a piece I just want to spend a few minutes talking about today. That is a strategy not only to do universal health care, but to make two other critical investments in child welfare. The first is really meeting our obligation for preventive services in communities across the state so that families that have contact with the child welfare system don't face the risk of having their children removed. The more we can support families after a CPS investigation and to reduce the likelihood that a child has to leave their home, that's critical. But the other critical and most innovative part of the Children and Families Reinvestment Act is the opportunity to create a new child and family well-being fund. This is where I think we at CDF are so excited about opportunities to serve and support families locally with local accountability, with creative funding for homegrown solutions that really meet children and families well before the crisis that might bring them into contact with the child welfare system. And we really believe that the Children and Families Reinvestment Act, and especially this new Child and Family Wellbeing Fund, creates an enormous opportunity to build on all of the structures that we're talking about across CDF and with our partners, to invest in children and families in ways that we haven't in generations. So I'm so excited to encourage you to support Justin, to support all of the work that we're doing in child welfare by doing what Ben said, which is joining us by filling out this action alert, encouraging other members of the legislature to get on board with these really robust, powerful, groundbreaking strategies to support children and families, especially right now. I'm going to turn it over to another incredible colleague, Tanisha Drayton from Youth Represent, to talk a little bit about youth justice. Thank you so much.
Thanks, Julia. Hey, everyone. Like Julia mentioned, my name is Tanisha Drayton. I work with Youth Represent as the Policy and Youth Program Coordinator. It's really invigorating to hear everyone in this space and just to talk about, the different avenues of justice that we're all taking and fighting and advocating on behalf of and for. So at YR, in partnership with CDF and many other coalitions and groups throughout the city, we're working on this Youth Justice and Opportunities Act campaign. So with the campaign, there is a heightened sense of understanding why it's important to expand something called the Youthful Offender Law. So as it is right now, the Youthful Offender Status Law, or YO, permits an alternative to prison sentencing and seals the record for people for many cases. When we think about the ripple effect of when a young person reaches contact with the legal system, they can go through society having a double consequence when, after they've done their time, after they've been convicted, after they've been sentenced, they move on, they make decisions to intentionally, be different with their decision making, but are faced with the reality of not being able to find decent employment, not being able to pursue educational opportunities because there is, potentially a felony on their record. YO allows for that to be sealed from the public, and that hindrance isn't there. But there are some limitations. A judge can only grant it to young people once, and people above the age of 18 are not eligible for it at all. So with the Youth Justice and Opportunities Act, that would allow for judges to grant it more than once for young people who they deem it would be fitting for in the interest of justice for both that young person and the neighborhood and communities that they're coming from. And it will also increase the age eligibility. We don't limit, right, poor choices or mistakes being made to an age range of folks that are 18 and younger. Like, things happen, and we believe that if it could be extended to folks up to the age of 25, that would be the best route. So that way there's no hindrance when people decide to pivot and move on with their lives after they've had contact with the legal system. One of the other huge things about YJNO, if it is passed, as well as that it would be automatic for certain misdemeanors and low-level offenses, which would change the entire process that happens within the court to begin with. So it's, for all the reasons that were named, it's so important for us to think about both the immediate, right, like, instances of what takes place when a young person is faced with like arrest, being in a court, and all that comes with that. And then when that experience has, transitioned, when it's over, then having to deal with the effects that happen afterwards. And we hope that by passing YJNO, or Youth Justice and Opportunities Act, it would allow for people to be able to move on in a way that actually, promotes justice and their well-being, both for themselves and for the people that they share space with in their neighborhoods and in their communities. So thank you for letting me speak, and I will pass it to Pastor Williams.
Thank you so much, Tanisha. God bless you, everybody. I'm Pastor Mark Williams from Bethel Gospel Assembly, and it's a pleasure to be on this show here to really just share. I am from Bethel Gospel Assembly, located in central Harlem, and where our Bishop Carlton T. Brown is the pastor. And I'm also personally a former criminal justice advocate with an organization called CCJA, Consultants for Criminal Justice Alternatives, that was operating under FEGS back in the 1990s. And I've gone into court. I used to prepare pre-pleading and pre-sentencing reports outlining the background of defendants and all of the recommendations for alternative sentencing. And I noticed even back then, when we were engaged in going into court and advocating with these bio packs, 10, 15 pages that I would write up on a background of a defendant, I noticed that my list of defendants and participants in the criminal justice system were becoming younger. And I was representing 16-year-olds who had Rob 1s and Rob 2s. I was going into their neighborhoods, talking with everybody. So a lot of boots on the ground work. I brought that into my ministry as a youth pastor in my church. And I'm doing pretty much the same thing, even though I'm not in a formal agency. I've brought it into the faith realm here at our church, which was a perfect match because our church is 104 years old. And we've been here evolving with the community and being able not only to deal with the top down, but the bottom up, and become more than just a church in the community, but become a community church, so that we understand that whereas we have legislation that will handle, that we expect to handle guns and all kinds of laws and changing of laws and policies to accommodate everything that Justin was talking about and all of that, we need to understand that it's also going to take boots on the ground. And so we not only talk about community development, but we talk about community-driven development, looking around for the sources that we have, especially as we gather all of the resources of churches and nonprofits on the ground, and we network and we communicate, we have the ability to be able to make some movement in some of these issues on the ground and do it in a way that is financially and economically good, because it's not something that depends on programming budgets and everything. And it's not just faith-based, but it's faith-informed. And that's what we bring to the table. This is a mandate for us, whether there's money coming from the government or not. We have a social justice ministry. We have a gym ministry that deals with a basketball and that. We have a tech center where we can open it up. We have this. And although it takes some money, we know that if the money kind of like dries up, we're going to have something going on where we can sustain both benevolently and empowerment wise to get our youth to move forward and teach them how to dream, because the issues on the ground are a lot more complex than what any legislation can do with just a stroke of a pen. This is boots on the ground. This is us doing it for us and coming together as a community. And so I applaud all of Tanisha and Justin and all these young people who are not only in the game, but they're in the game because they've experienced, they are stakeholders. And so they go in. And so I salute you, even as a father, a husband of 37 years, a father of 3 grown children now, and a grandfather of 8 going on 9. I applaud you. And I'm glad that you're in the game. You are the future. You know, there's a whole generation that's not picking this up. And so you need to make sure that you hold us accountable. And we are ready to cooperate with you in whatever way we can to make sure that we deal with the issues. It's not just gun control, it's about dealing with the mentality behind the trigger. And so we need to understand that. And that's what we do here at Bethel. We get down to, I have a ministry called The Space, where we have the Supportive Parental and Personal Assistance Center for Empowerment. What is that? In-person chats. Come in, the children will go to our youth areas. We call them out of the shelters, wherever they go to the youth areas, and they have a good time in our gyms. They do other activities while the parents are in a space with a trauma specialist, Christian professionals who are not just professional, but they're driven. They want to see people better. They want to see people well. And so we want to be able to replenish our community by cooperating with all of these community stationed services, Osborne Society, others, Living Redemption Youth Opportunity Hub. All of these are, some of them are faith-based, many of them are faith-based and secular-based, but the idea is we have the same idea of making sure that things are being taken care of on the ground as best we can. If we can't do it individually, we do it collectively, because united we stand, divided we fall. So thank you so much for being a part of this. We're putting our I'm glad that I met all of you, and I'd love to have you guys come on up and sit in the space and let's talk about how we can come together and really push this thing and whatnot. Our bishop is open to that. We're just going forward and trying to do whatever we can to make sure that this thing is better, because legislation takes too daggone long. It's time for us to go out there and do what we got to do. Put up or shut up at this point. I'm not going to lean on this. We're coming out of this COVID. We are coming out of this COVID, and we're not doing it accidentally or haphazardly. We are doing it deliberately and proactively. We're going to reset, reboot, recover, respawn, and rebuild. That's what the whole solution is, for us to be able to go back to the basic tenets of faith and see what it is in the redemptive that we can translate into the natural, and so that people can live better lives. We are just determined. So God bless you right now, and I'll hand it back over to Julia Davis.
Thank you, Pastor Williams. We are unafraid. We are taking this fight for our young people and communities. We know that this is the time that they need the investments and the supports for our recovery, for our growth, for our self-determination, for our freedom, for living the lives that we're entitled to in our communities. And I want to encourage you to feel the fire that Pastor Williams just brought to this conversation, to feel what my colleague Tanisha just brought to this conversation. We have so much work to do for young people. And we can wait on legislation, and we can't wait on legislation, right? We have to take that path, and then we have to ask for what we need right now. And that's why this budget is a crucial moment. It is a moment where we need to see the state make commitments to the investments we know will really meet the needs of community and address violence. Everyone is entitled to be safe. Every young person, every member of our community is entitled to be safe. But we won't get there through punitive approaches that roll back reforms. We will arrive at that place when we are ready to support each other and the communities that we love. And we're willing to show that with a just budget that reflects those commitments. So I really encourage you to, at this moment, to find our action alert there, to find a way to take a moment out of your day to uplift these issues and the investments that we need in raise the age implementation, in community supports around reducing gun violence, around youth build, around after-school programs, around building the communities that our young people need. Our young people are in an incredible moment of trauma. The death and devastation of this pandemic has been visited on the same communities that have suffered from the plague of gun violence, from the plague of over-policing, from the plague of over-surveillance. We're going to talk about mental health next, and I think it's such an important way for us to close out this conversation. But if we're not meeting the needs of young people and we're not showing that in a just budget at the state level, then we're failing. So I want to thank you all, especially Pastor Williams, and thank you, Tanisha, for bringing that fire to this conversation and resisting what is becoming a dominant conversation that is ignoring the resources that young people and communities need. This is what we need right now to create true community well-being and community safety. So with that, I'm going to pass it to Dr. Green to give us some really powerful understanding of the moment that we're in with mental health.
Thank you so much, Julia. And thank you to everyone who has spoken thus far. You have really invigorated me, and I'm just delighted to be here and share this space with all of you. Again, good morning. My name is Dr. Lena Green, and I'm the Executive Director of the Hope Center. HOPE stands for Healing on Purpose and Evolving. And we are a community-based mental health clinic in Harlem, and we are connected to the historic First Corinthian Baptist Church. Our goal is to provide quality therapeutic services to the Harlem community and beyond in an effort to directly impact the mental health needs of our community and promote mental health and wellness. And our vision is to empower and support our community in the process of creating and sustaining lifelong wellness. I'm a native New Yorker, and as a clinician working and living in a community that has been greatly impacted by the mental health challenges, I have seen, like many of you, firsthand the trials that our youth and our families are facing every single day. These challenges have hit communities of color especially hard because they are more likely to experience socioeconomic disparities, such as exclusion from healthcare, economic, and educational resources. And these disparities most certainly contribute to poor mental health outcomes. Also, harmful and negative attitudes and beliefs towards people who live with mental health conditions and challenges are still pretty pervasive and really greatly affect our young people. Our young people are facing many major mental health consequences as a result of the pandemic. And if you, like me, have young people in your life, you know that what it has been like to support them, to love them through their challenges, and to do your best to usher them into a space of safety. In 2020, the Surgeon General warned the nation about the youth mental health crisis. From what we've seen and what the research has shown is that emergency visits have been up for mental health related challenges. And we've seen sharp increases in depression, anxiety, grief, and loss. And it's also important to note the significant rise in suicide attempts among our adolescents. These youth, and especially youth of color, the increases are staggering and also scary. But the good news is that there are steps that we can all take towards action. So by requesting more funding, by including mental health support in our schools and our after-school programs, by increasing our access to community-based, culturally sensitive care, and also by increasing telehealth services. So we need to continue to raise awareness about these important issues, provide resources to support these much needed care and access to services, and then also increase research in these areas to help us move forward. I want to also lift up before I end to say that it's important that we hear the voices of our children, that as we're planning and moving forward in these things, that we don't leave the voices out of the very people that we are trying to serve. We cannot do this without them. And I want to encourage all of us to give them, that is our young people, an opportunity to share their experiences, for us to listen to their examples of strength and resilience, and to think about the strategies that they have and they've thought about to support them, how we can support them as we move forward and blaze trails and find a new path. So thank you so much for your time. And I'm going to kick it over to Melty Nieves from CDF.
Hi everyone, my name is Metzley. I'm a BPL scholarship recipient and I received the award back in 2018. I'm a current senior at Barnard College. I'm also a college bridge coach at a high school, New York Public High School. So excuse if you hear the background, the noise. I work in the college office, so it's pretty busy in here sometimes. To start off about talking about mental health, I feel like it's very important to also acknowledge that there is a big stigma around youth and them experiencing mental health. So like I'm 22 and like now I have the resources and I have the words to explain myself and advocate for myself when I'm not feeling good or when I need mental health support. But when I was younger, it was very hard for me to explain myself, to explain to my teachers, to my parents that I needed some type of support. And I feel like oftentimes mental health is ignored with youth because we have this mentality that young people shouldn't have like problems, that, you know, you're young, like, what are you worried about? Like, you're so young, like, just focus on school, you'll be fine. And I feel like that generally puts youth in a bad place where they may not even feel comfortable even asking for help or support later on. And so youth are experiencing new emotions, experiences, especially now that we are in COVID and we've been in a pandemic for the past 2 years. There's certain youth that may not know how to navigate these emotions. And being young, honestly, does not mean that life can't be stressful. And also moving into like schools, I feel like it's also critical to acknowledge that youth are spending a majority of their time in schools. So focusing on mental health in schools and institutions is really extremely important. And I feel like for me personally, like I went to a high school that had like over 1,000 kids with only 5 guidance counselors. And when you have such large schools and such a big gap between healthcare workers, social like therapists with like their students, it's really hard for students to build a genuine relationship with these folks that are supposed to be there as a resource. So just because youth are not taking up these resources also does not mean they don't want to, because it's also it's very common for youth that are coming from different backgrounds that most of them, or some certain populations have not really experienced mental health or haven't even been talked to about mental health. So like for me, I have a Mexican background. My parents are Mexican, and we're an immigrant family. And in immigrant communities, even now, mental health is still very taboo. And so just because youth are not taking up these resources does not mean that they don't want them, they don't need them. It may just mean that they just don't know what these resources are, or just haven't experienced that before. So to them, it's like uncomfortable, it may be new. And we also need to provide information about what these mental resources are. That way it could be a little bit more welcoming for you to take upon these resources. And I also think that, again, emphasizing that we are in a pandemic, I feel like educators in schools need to have a lot of compassion, especially right now, because I feel like a lot of the times educators have this expectation that students must trauma dump in order to get this compassion. And lastly, I also do want to emphasize that youth are experiencing a bunch of intersectionality of their identities. So like many people on this event have mentioned youth impacted by violence, the judicial system, immigrant youth. They need this type of mental support in schools, outside of schools, because having access to therapists, to social care workers can supply direct resources to these folks. And now moving to, I guess, social workers and therapists, it's also very critical that these therapists and these social workers look like the youth that they're supporting, that they're working with, because that can also help build a genuine relationship between students and healthcare workers. And so just to tie it back to like COVID and like living in a very different dynamic right now, like I really think it's very important to demand New York State legislature to increase mental health services in schools. So like guidance counselors and social workers are like a very, very crucial part of our education system. And so New York must pass the new mental health supports in schools to ensure that all elementary, middle, and high school in New York State have a full-time licensed social worker and a full-time licensed psychologist on staff. Because if I'm being honest, I generally, looking back to my K-12 education, I don't really remember even having access to these type of resources. So and now that we really do want to emphasize mental health, I feel like this is a very, very big, important work that needs to be done. And just to pass it on to Melissa from the CDF New York Health and Economic Mobility Policy Associate. Thank you, everyone.
Yes, thank you so much, Metzli, for those really open and honest words. You're a very tough act to follow, but Metzli did an amazing job sort of speaking to what is sometimes a difficulty in speaking about mental health, especially for our young people. And we know, as Dr. Green described so well, how much of a toll that the pandemic is taking on mental health of our young people. Within the last year, both the American Association of Pediatrics and American Academy of Child and Adolescent Psychiatry have declared national emergencies in child and adolescent mental health. And as Dr. Green mentioned, the US Surgeon General has as well. And we know so well that we really need to sort of bolster the capacity of our schools to meet the mental health needs of our students. That is imperative, as Metzli described. We know that guidance counselors and social workers are a crucial part of our education system. That is wonderful work that my colleague Melissa Clark leads in our office. And so New York must ensure that all elementary, middle, and high schools in New York have full-time licensed social workers and full-time licensed psychologists on staff to meet the needs of all of our students. There's a Take Action link below you on the website that you can use to email and contact your legislator and demand that they support this legislation. Furthermore, we need New York to expand the population of students in our state who can receive Medicaid-covered school mental health services. This is critical. And we can do this by submitting a Medicaid state plan amendment to CMS that would permit our schools to provide Medicaid-covered services to all students covered under Medicaid, not just those with individualized education plans. This has always been critical, but it's more critical now than ever. Dr. Green described the high burden of youth suicide in New York. We have particular concern of suicide among Black youth in our state. And so we really must bolster suicide prevention resources in New York. Our state needs to establish a Black youth suicide prevention task force to take some urgent and deliberate action to provide suicide prevention resources for our marginalized youth. And lastly, we know that so many of our young people have been facing a number of barriers accessing behavioral health services via telehealth. Our state must continue to increase access to in-person mental health services for our youth, and to really carefully evaluate the quality, access, and the equity of telehealth services, primarily ones that our young people are receiving for their behavioral health. And so with that, I believe I am passing it back to our Executive Director, Christina.
Hi, actually, this is Ben. I'm going to jump in for a moment, if the camera can come to me. Ben Anderson, Children's Defense Fund, again, the Director of Health and Economic Mobility. And I'm going to take a moment to talk a little bit about childhood lead exposure. But before I do that, I just want to shout out that we have a number of things that folks can do today. So if you are moved by what you've heard, and even if you're not moved, like, it's really important to jump in the chat and click the links to take action, to let your elected officials know that you want universal childcare, that you want more services in the community. For our youth, that you want more funding for kin gaps so that we're not breaking families apart and that we're keeping families together, that you want more mental health services for kids. So again, if you're connecting with us via YouTube, the links are in the chat. If you're watching this later or are connecting on our website, the links are below the video. So real easy. Put your information in, it will find your elected officials for you. Generate a message that you can use and edit and send it out. So with that, let me turn now to childhood lead exposure prevention. So the Children's Defense Fund of New York is a founding member of Lead-Free Kids New York, a statewide coalition working towards ending childhood lead exposure. We started the coalition because New York has more children who suffer from elevated blood lead levels than any other state in the US. There are some communities in New York that have lead exposure rates that are 5 to 6 times higher than Flint, Michigan at the peak of its water crisis. Black and Latinx children are more likely to suffer from lead exposure than their white peers in New York. And similarly, children living in poverty are more likely to suffer from lead exposure than their more resourced peers. So not only is childhood lead exposure a completely preventable tragedy, but it's also a health equity issue. It's a racial equity issue, and it's an economic equity issue. That's why this year we're asking the legislature and the governor for $1 billion to help find and fix lead hazards. to rebuild our New York State public health infrastructure, to combat lead exposure, and to train our workforce to know how to go into homes and safely and properly renovate them so that children no longer have to suffer from irreparable harm to the brain and behavioral challenges that come with it. So with that, I'm now going to turn it over to Senator Cordell Clear. Senator Clear? You're on mute, Senator Clear.
I didn't know you'd call me so quickly. I'm sorry. I just jumped from another meeting. But you know, it sounds like you're talking about lead poisoning prevention, which is an issue that is near and dear to me as someone who has been affected by it, who lived in a community that was primarily affected by lead poisoning. I always refer to it as environmental racism, not because of the fact that lead only affected Black children, but because of who it affected is why I feel like nothing was done sooner. These were the most vulnerable, people with the least voice. These were not the real estate lobby. These were not the big industry who profited from not making these changes sooner. But you know, as I always said to people when they asked and said, oh, it will cost us. How are we going to pay for it? Well, the human cost is greater. How do we pay for that? How do we pay for the loss of IQ? How do we pay for the barriers that are created, the learning disabilities, the emotional issues that children suffer from? So I was fortunate enough to be a part of a coalition of people from all walks of life, from all professions, who came together and stood up against the very, very powerful real estate lobby at the time. And that was, my journey began in 1993, but there were people fighting long before me. So this was an effort that took decades. And we were able to pass finally in 2004, the most comprehensive lead poisoning prevention bill in the country. But it took so much. And how do we repair the lives that it had affected? And we all know that, you know, coupled with race and other inequities, and these lead poisoning just really devastated the lives of so many children and so many people who were already living in communities with already failing schools, without access to healthcare. So this just compounded the issues that they had to face, families had to face. And it is time, when that law was passed in 2004, I still work with people around the state and across the country even, because there still is no protection for children in New York State. And it is heartbreaking that we are still living with this, and there are some counties and municipalities where we're very fortunate to live in the 5 boroughs and have the Department of Health that we have, and HPD, and have agencies that can be moved to enforce and to protect. But even with legislation in some of these other counties and other places across the state, it's very difficult. The housing stock is different. It's the same age, that doesn't change, but it's not a bunch of multiple dwellings necessarily. Sometimes you're talking about home ownership and someone's renting, and there's a cost attached to it. And it's time for us to help those homeowners make those homes safe. And it's time for us to help those municipalities with the Department of Health, with the inspectors and the agencies that they need to do the work in the cases where homeowners cannot. That's the very least we could do. It's time for it to stop. It's time for it to stop in our communities, and we do need to protect our children. I am in support of health equity in New York. Lead poisoning, that is something that I am definitely supportive of, and wanting to see that happen in New York State this year, as well as better enforcement and more regulations, even in New York City, because quite frankly, the cause of lead poisoning varies, and it has varied for years. You know, there was one time that there was lead in gasoline, and we got them to stop selling leaded gasoline, but it had seeped into many areas and created brownfields, and it contaminated soil. We stopped using lead paint, but we stopped manufacturing it, but there were surpluses of it, and people still continued to use what was left over. So it's on bridges, it's on a lot of things that are around us. So there are more steps that have to be taken for us to be completely lead-free, but it starts in the home. This is where our children spend most of their time. This is where we know most of our children get lead poisoning. We know this. So this is where we have to start. Our homes have to be healthy. Our schools have to be healthy. Our whole environment has to be healthy. And we just have to protect children. I'm gonna stop right here because I don't know how much you wanted me to say. So if there's any questions that anybody has.
Thank you so much, Senator Claire. We really appreciate you being here and taking the time with us today. With that, I'm going to turn it back over to our executive director, who's going to close us out.
Good morning, still everyone. I want to thank the New York Children's Defense Fund staff for their hard work in putting together this amazing group of individuals to share about what some of the budget priorities should be for New York State. And so I actually want to close out with one of Ms. Edelman's quotes. Miriam Wright Edelman is the founder of Children's Defense Fund New York. And so I actually have a picture of her in my office with this quote. And so I will share it with you right now. She said, and I quote, "You just need to be a flea against injustice. Enough committed fleas biting strategically can make even the biggest dog uncomfortable and transform even the biggest nation." I'll repeat that. You just need to be a flea against injustice. Enough committed fleas fighting strategically can make even the biggest dog uncomfortable and transform even the biggest nation. And so we know that, New York is looked to as, a beacon of progressiveness throughout this country. And so what we need for you to do for us is to stand with us in this moment. As Ben and everyone have stated, we have various calls to actions connected with each issue that we spoke about. We have a call to action for the state to invest in universal childcare. We have a call to action for the state to make the necessary investments to help end childhood lead poisoning. We have calls to action to make sure that the state doesn't try to scapegoat children and young people when it comes to some of the rising gun violence that we're seeing, but that focuses the state on making sure that it is funding communities in ways that address the root causes of gun violence, which has to do with issues of poverty and also has to do with issues of public health, right? We also have, calls to action as it relates to the child welfare system, right? On wanting to make sure that we are creating a system that isn't tearing families apart, but that is keeping them intact and providing them with the necessary resources that they need in order to stay together and in order for their families to flourish and to thrive. And we also have a call to action to address the mental health crisis that is taking place, not only in New York State, but around this country as it relates to the Black youth suicide crisis and everything else. And so we need to make sure that our schools have sufficient mental wellness, mental health care staff so that our young people can receive the treatment that they need. And so making your voice heard on those issues are so critical. So please do not sit through this entire hour. Do not sit while we talk about the need for the state to act and not complete our call to actions. Because if we do so, like Ms. Edelman said, if we are all making our voice heard, if we are sharing those calls to actions with our family members, with our friends, then our voices will be heard and the state will absolutely have to act. And so I encourage you to text your friends, your family members, your community members, text them those action alerts, post them on your social media. Please help us to spread the word that this is what our children and families and communities need in order to get through this time and in order to thrive. And what I'll lastly say is that one thing that the Children's Defense Fund New York is focused on is making sure that we are pushing policies that address, the entire child, right? And so I've been thinking a lot, actually this morning, about that particular goal that we have. And so I think that in order to address the needs of the whole child, you have to address the needs of the whole community. And so that's why it is important that whether we're talking about, children who are impacted by the child welfare system, whether we're talking about children who are impacted by youth justice, whether we're talking about children who are in our neighborhoods dealing with mental wellness issues, all of those children are connected. All of those children are our children. And so it's important for us to stand up for every child. So please make sure you take advantage of our call to actions in the YouTube chat. We have the links in there on our Twitter. We also have links to the call to action. So if you need to have the links in order to share with others, please do so. And so thank you so much for taking time with us on this Friday morning.